Philip Waddell is representing Deputy Mayor Melanie Herzog, all in a voting capacity. Next on the agenda is the adoption of the minutes for the board meeting held February 25th, 2021. Are there any questions or comments or changes? So may I have a motion to approve the minutes?
Motion.
Second.
So I'll poll each board member separately. Dr. Katz?
Yes.
Dr. Calamia?
Yes.
Dr. Shoxi? Dr. Harrison?
Yes.
Philip Weddle?
Yes.
Philip, thank you. Scott French?
Yes.
Barbara Lowe? Barbara?
Yes.
Thank you. Robert Nolan?
Yes.
Sally Hernandez Piñero?
Yes.
Frida Wang?
Yes.
Benioski Peña Mora?
Yes.
And Jose Pagan, yes. So the minutes are adopted. We had an executive session earlier today. So during the executive session, the board received and approved oral and written governing body submissions from NYC H&H Kings County and Kohler Nursing Facility. The board also received and approved semi-annual governing body reports, written submissions from NYC Health and Hospitals Woodhull. The board also reviewed and unanimously approved the governance committee recommendation to appoint Yvette Villanueva as Senior Vice President for Human Resources. We convened the first of 5 2021 annual public meetings for each borough with Staten Island on Tuesday, March 16th. The remaining meetings will convene at 6 p.m. and a determination would be made at a later date as to whether they will be in person or virtual. The dates are Manhattan, it's going to be Tuesday, April 20th, Queens, Tuesday, May 25th, Bronx, Tuesday, June 8th, and Brooklyn, Tuesday, June 15th. VENDEC approvals. Since we began the process of approving contracts prior to VENDEC approvals, there are 3 items on today's agenda requiring VENDEC approvals, of which 2 have the approval. There are 7 items from previous board meetings pending VENDEC approval. Since we last met, we have not received any VENDEC approval. We will continue to notify the board as outstanding approvals are received. So let's move now to the resolutions. Rita, you take over here, so I have to excuse myself.
Calicia, did you say that Dr. Choksky was on?
He is currently not on the call, so you can go ahead.
Okay, great. Is Jose gone?
Yes, he's gone.
Okay. Don't tell him I wanted him to leave or anything, but I'm kidding. So, Dr. Calamia, I think this resolution is yours to read.
Frida, I will have also to excuse myself, okay? I will quit and then come, okay?
Are we okay for quorum?
Let me just double check here. Only have 8.
What's the total number? The total number. The total is 8. No, but our total on the
Total of the quorum is 9. I had one.
Should I just go call Sunny right now and find out what the issue is? Or did you expect that?
Okay.
Should I call?
Let me call you. Frida, can you hold 1 minute, please? We just have to figure out one issue. Andy. Hi, this is Calicia. Jose, we're gonna table item number 2 for a minute. We're gonna discuss item number 3, carry on with the agenda, and we'd come back. We have to do some checks and determinations, and we'd come back to item number 3 when we have made a determination.
Okay, so item number 3 then, right? Next.
Yes.
For Calamia.
Okay, yes, thank you. So item 3 is authorizing funding for the New York City Health and Hospitals Corporation, the system, to continue to operate under the terms of its affiliate
You guys gotta carry it.
with Physician Affiliate Group of New York, PC, PAGNY, made for the provision of general care and behavioral health services for a period up to 6 months, with the system facilities served by PAGNY to be indicated as below: Lincoln Medical and Mental Health Center, Morrisania Diagnostic and Treatment Center, Segundo Ruiz Belvis Diagnostic and Treatment Center, Jacobi Medical Center, North Central Bronx Hospital, Harlem Hospital Center, Renaissance Health Care Diagnostic and Treatment Center, Metropolitan Hospital Center, Coney Island Hospital Center, and Kings County Hospital Center, with an overall cost of the extension not to exceed $364,938,066, which includes a 10% contingency of $33,166,188. This motion is presented to the board directly.
Thank you, Dr. Calamia.
So I'll just briefly speak to this to say that these agreements are complicated. We want to absolutely get them right. We've had very productive discussions with PAGNY up until the very last moment, but we were not quite able to resolve all the issues in time for this meeting, allowing us, their contract already allows for a month-to-month, and allowing us these dollars will give us the time to resolve this agreement in the best possible way. Thank you.
Thank you, Dr. Katz. Any questions from board members? Let me go through the list here. Dr. Calamia?
No questions.
Thank you. Dr. Shuck?
But Jose, are they going to go through the presentation or not?
I don't think so.
Okay.
Give me 1 second. It's just,
Presentation is item number 2.
yeah, it'll be for item number 2, the presentation.
Got
So
it.
yes. So if you have a question on the presentation, please ask now. Dr. Myla Harrison?
No questions.
Thank you. Philip Guero?
No questions.
Thank you. Scott French?
No questions.
Thank you. Barbara Lowe?
No questions.
Robert Nolan?
No questions.
Thank you. Sally Hernandez Piñero?
No questions.
Thank you. Frida Wang?
No questions.
Thank you. Fenioski Peña Mora?
No questions.
Thank you. I should say that there is actually a presentation attached to the resolution with a few slides that basically summarize what Dr. Katz mentioned. I should have said that. Thank you. So hearing no questions, then I would like to ask for a vote. Then Dr. Katz?
Yes.
Dr. Calamia?
Yes.
Dr. Shuxi? Dr. Harrison?
Yes.
Dr. Philip Guero?
Yes.
Thank you, Philip. Scott French?
Yes.
Barbara Lowe?
Yes.
Robert Nolan?
Yes.
Sally Hernandez Piñero?
Yes.
Frida Wang?
Yes.
Fenioski Peña Mora?
Yes.
And Jose Pagan, yes. So the resolution is approved. Thank you so much. Dr. Katz, your
Right.
report?
So want to recognize that this represents 1 year with COVID-19, and it's just about this time a year ago that I remember getting a call from the emergency department at Elmhurst, Israel Roca, calling to say that in the last 2 hours they had intubated more than 10 patients, and no one had ever seen anything like this before. We've talked about the extraordinary efforts, and I'm not going to, go through all of it again, but just to say we did manage more than 108,000 patient visits, more than 54,000 hospitalized patients with COVID have been safely discharged. We're still doing lots of testing and tracing. We're very proud of our role in vaccinating people, as well as taking care of people who are recovering from the symptoms of COVID. We'll take care of them both at our 3 new COVID-19 centers of excellence in the communities hardest hit by COVID, as well as at our other clinical sites. I want to note that as an organization that is focused on fairness and equality and treating everybody with respect, how disturbing the recent violent acts of hate against Asian Americans and Pacific Islanders have been in our country. We stand with people of color to always say that Health and Hospitals stands with you and will be there always to support you and to condemn racism in all of its forms. I want to mention that I did our city's preliminary budget hearing on March 22nd, and that it went very well. I want to say congratulations to the Biden administration for ending the public charge rule. This was an issue that, as Health and Hospitals, we put a lot of effort into, pointing out that even the suggestion that people's immigration status could be compromised by seeking needed medical care was a terrible mistake, and that we stood for providing quality care to everybody regardless of their immigration status. I issued a declaration of emergency dated March 1, 2020, related to emergency contracts and procurement, subsequently updated and reissued through February 28, 21. There are currently no declarations of emergency for contracting in effect. The health system has entered into 3 new emergency agreements not covered in our prior reports. 2 of the new agreements are for temporary staffing for the hotels we're managing on behalf of the city, our acute care facilities, post-acute care facilities, as well as temporary staffing for expanded vaccination program. One agreement was executed in December 2020 and the other in January 2021. The 3rd new agreement is for building security services at the COVID-19 testing sites. The Department of Buildings had procured and held this agreement, but our health system manages these sites, and so we agreed to an assignment of the agreement to us in February 2021. The total spend through February 2021 is $104,000. No, $104 million. Yes. Thank you very much for doing the listening to the report, and I'm happy to hear any suggestions or questions that you might have.
Thank you, Dr. Katz. So any questions from board members? Dr. Calamia?
No questions.
Thank you. Dr. Shoxi? Dr. Harrison?
No questions.
Thank you. Philip?
No questions.
Scott French?
No questions.
Barbara Lowe?
No questions.
Robert Nolan?
No questions. Thank you, doctor.
Thank you. Sally Hernandez Pinheiro?
No questions.
Vida Wang?
No questions. I just want to say thank you for your report and your comments, Mitch. Dr.
Thank you.
Penioski Peñamora?
No questions.
Thank you. And I don't have any questions, so thank you so much.
Thank
Dr.
you.
Katz.
At this point in the meeting, we're gonna go back to item number 2. Recuse on the record. You recuse and you have to say.
Yeah, so I'm gonna recuse myself for the record. So,
Fanny,
I'm going to recuse myself for the record.
thank you. As the meeting would now be chaired by Frida Wang, the vice chair, and for the record, I'd repeat the voting members. We have Dr. Katz, Frida Wang, Ms. Lowe, Dr. Harrison, Philip Odell, Mr. Nolan, Sally Hernandez Pinheiro, Scott French, and Dr. Calamere. Frida?
Okay, great. Thank you. Dr. Calamia, could you please read the resolution into the record?
Yes, thank you. So a resolution is authorizing New York City Health and Hospitals Corporation, the system, to execute amended and restated affiliation agreements, with each of one, NYU Grossman School of Medicine, NYU, and two, Icahn School of Medicine at Mount Sinai, each made for the provision of general health care and behavioral health services for a period to end on June 30th, 2025, with the system facilities served by each medical affiliate and with the cost of each affiliation agreement not to exceed the amounts as set forth below. NYU, Bellevue Hospital Center, Gouverneur Healthcare Services, Kohler Rehab and Nursing Center, Henry J. Carter Specialty Hospital and Nursing Facility, Woodhull Medical and Mental Health Center, Cumberland Diagnostic and Treatment Center, for an amount not to exceed $2,008,589,842, including a 10% contingency of $182,599,076. At Mount Sinai, Elmhurst Hospital Center, Queens Hospital Center, certain neighborhood and school-based health center sites affiliated with Cumberland Diagnostic and Treatment Center and Morrisania Diagnostic and Treatment Center for an amount not to exceed $1,416,148,570, including a 10% contingency of $128,740,780, for an overall total not to exceed amount of $3,424,738,412, and this is being presented as a motion to the full board.
Thank you, Dr. Calamia. I think, I'm not sure if I'm turning over to Dr. Katz or Andy.
To Andy.
Okay.
And actually, Deb is going to lead us through the first few slides.
Good afternoon, everyone. I'm Deborah Brown, SVP for External and Regulatory Affairs, and I'm the leadoff batter for my colleagues, Dr. Allen, Andy Cohen, and John Elberg. You'll be hearing from all of us. And thank you, Dr. Calamia, for reading the resolution. We're going to start with just a quick setting of the table about what we're talking about here. In this instance, we're talking about our relationships, particularly with NYU and Mount Sinai. You can see the effective dates. These relationships cover professional services, and we think of those as doctors, APPs, technical staff. John's going to be talking about this in a little more detail, but these are primarily cost-based arrangements, and so we're going to be including compensation, fringe, and overhead. We are really pleased to bring this conversation to you today. This is, of course, a significant amount of work, not just from those of us speaking today, but from several other very important contributors for whom we are very grateful. It's important to recognize that with these affiliations, we're continuing to create a framework for ongoing innovation and stability. And it's really important to us to express to you that this is very much a partnership with NYU and with Mount Sinai. To that end, we also specifically want to recognize the very hard work and leadership of Dr. Mashapur at Elmhurst, Dr. Link at Bellevue. Again, they are the top of a team working very hard on these issues, but things wouldn't get done without them. One other note is just to reinforce legal arrangements, legal documents, they only exist to memorialize relationships. And these are very much living and breathing relationships. We're trying to facilitate them so that they can evolve and they can respond to change over time. That's very critical to this work. Next slide, please. So just opening up the lens for just a minute, these relationships have existed in some form in sort of the modern iteration of what H&H is. They were actually envisioned in the H&H Enabling Statute in 1969. And for New York City history nerds like myself, they actually harken back to the 1780s. There was a version of these agreements back in place when private hospitals put faculty and medical students at Bellevue when it was an almhouse for the poor on the site of what is close to City Hall now. Very interesting if you want to read about it, but the point is this is very much a proud history of medical and organizational partnerships, and we're happy to continue it. As you can see on the slide, the meat of this slide is laying out the facility and then its relevant affiliate. So NYU, Sinai, you'll see those at the top of the list, a little bit down in the bottom for Gotham and for Kohler and Carter. And then separately, we of course have our relationships with PAGNI, smaller one with SUNY. We'll be talking about those separately, not in this presentation. Just on the sidebar, important to note that these affiliation agreements are about sites, and that's important both for operations, but also because it very much speaks to the culture at each of these facilities. We want to make sure that there is a partnership between the particular facility and the affiliate who is partnering with it. Andy?
Great. So on the next slide, thank you so much. At the beginning of our process of thinking about the renewal of our agreements with our partners, we established a set of guiding principles to keep us focused on our goals for this phase, next phase of our affiliate relationships. That conversation started quite some time ago, and we've all been through a lot. Things have changed over the last year, but the guiding principles have really remained at the core of our thinking about what we are trying to make progress on in this next iteration of contracts. So a quick review of these principles, which I believe you have all seen before. So the first, and again, these relate to our goals. One is to develop an overarching governance and management structure to improve decision-making efficiency and alignment between H&H, the facilities, and the affiliates. Two is to develop clear contract terms, flexible to innovation and changing care needs. Our old contract instrument needed an update very badly to make it understandable and aligned with what modern agreements really look like today. Third goal was to achieve financial and operational reporting transparency. This is based on the belief that more transparency between the parties will lead to better management of shared goals. The fourth principle is to align financial incentives with the affiliates and physicians. In healthcare, providers are increasingly paid on the basis of risk and value-based metrics and quality. Where there are any incentive of payments, the principle is that they should align with these new innovative payment models and notions of quality. 5 is to maintain sustainable compensation and benefit packages. We live in a competitive environment for physicians, but also a competitive environment for resources. We have to make sure that our compensation packages are financially sustainable, but also allow us to recruit and retain great doctors, leveraging some of the great features of working for our system. Sixth principle is to enhance the patient care model. We want to ensure that the right care is available for patients when and where they need it, and that our contract allows for flexibility and innovation. 7 is to establish attractive career opportunities for a diverse group of new and existing providers. We need to expand and manage our physician supply, and we need to ensure that we can attract diverse providers who reflect the communities of our patients. And the 8th principle is that we should develop contract provisions to allow H&H and the affiliates to effectively and fairly engage in research and medical education, both important things recognized in our Enabling Act and other places as part of our mission. However, where costs and benefits of those activities have changed over time, we needed updated contract terms to address them. Slide 5. So our next handful of slides, with some exceptions, will basically go over some of the key domains that these principles are in and review what some of the key elements of our expected agreements will do to address those principles. So the first set of principles are in the domain of governance and management. With respect to this domain, I won't repeat the principles, but I'm sure that you all can read them on the slide. So of the items that we anticipate will be in these agreements, one is that we will be providing affiliates and CEOs at the facility level with more management control over facility budgets. This will put more decision-making authority at the local level where solutions are best fashioned, an important goal. Second was to establish a multi-year budgeting process, which allows for longer-term planning and substantially more certainty to facility and affiliates over a longer timeline. Third, we are updating our contract instruments and anticipate that at the end of the day, these agreements will be substantially more accessible and digestible to the many people who need to operate under them. And fourth, we are updating a committee-based governing process at the system level. There is such a process at the local level in the JOCs, but at the system level, ensuring regular and standard communications between leadership at H&H and each affiliate. I will pass it on to my colleague, John Olberg.
Hello, good afternoon. Yes, under the financial terms, the guiding principles, certainly I think made sense to us, throughout the process, which is the aligning the financial incentives between the affiliates and the physicians. And we think, as part of the work that we've done thus far, there's plenty there for us to explore and leveraging, the relationships that we already have with our facility practice plans. And the other is making sure that there's enough funds available in this contract to pay fair wages and benefits, to our physicians and our providers. And we think we've accomplished that. I think it's important to note there's different features, right? And quite a bit of work has gone into the update of this contract. I almost look at it as almost a framework for the future, right? There's plenty of work for us to do, and many of these elements I think are interrelated. But for FY22, right, while we have agreement on the structure, with NYU and Sinai, for FY22 we're basically going to keep the same cost-based budget process going forward with the reconciliation. Processes that we already currently have in place. I think everybody is willing to move away from those and to the new budget features, but we think to give us another year to kind of implement these new measures, we'll stick with the old process. But I think what's key in this is what we term the workforce plan. And the workforce plan is both a planning document and really a budget tool. And what we're trying to get at here is that we want an engagement between the facility and the affiliate on an annual basis, kind of looking into the future, to discuss, what complement the number and the complement of physicians that we need, right, to meet our patient care, plans. So that will be part of the work that we do starting in July, to develop the workforce plan. And we're pretty excited about that process. And again, I think both the facilities and the affiliates are as well. But linked to that, right, is a multi-year budget. I'll talk a little bit more about that, but we think because the planning horizon and the budget need to coincide, and we think it makes more sense to have multi-year budgets in place. And, as Andy had said, we're trying to devolve the budget, down to the facilities. So that's another, new feature. We've talked a little bit about, the practice plan. There's, quite a bit of work to be done there. We have practice plans at all of our facilities except Queens and Woodhull and Bellevue, and we've all made the decision that we would want to implement those practice plans, at those locations. And again, we think there's opportunity there for both H&H and physicians, to benefit by working more closely together. And another last, feature is just the, securing additional cost recoveries for research and medical school education. Next slide. This is just, some of the features and objectives of the workforce plan. It's really pretty interesting. We've been looking at data today. It's bittersweet, right? That 25% of our physician core is at or approaching retirement age, right? And many physicians have dedicated their entire career to health and hospitals, but that's certainly a trend that we need to pay attention to. I'm sure many will stay with us longer, but I think we need to plan for eventually that we will need to replace those physicians. So that's certainly part of the workforce, plan. As I had mentioned, these are multi-year budgets. I think it also gives us, the opportunity to, again, working with the affiliate, focus more on recruitment strategies and also, maximizing, the provider clinical effort, right? We have work underway, really kind of with the affiliates, determining of a physician's time, how much is dedicated to teaching and administrative and grant-funded research. So again, we're excited about the workforce planning approach. Next slide. So this is a slide I like. Basically, what we're laying out here for using NYU as an example is how we're going to construct their budget. For FY22, you can see that in the big blue bar, part of the bar, 392 million. That's basically our estimate of how much it's going to cost in 22 to implement the workforce plan. From the workforce plan, we will develop a budget. Our estimate of that, even though it's not yet complete, it would be around $392 million. There's also a little bit extra money in there for what we're calling approved programming. So that's the first blue bar. As we had mentioned, the COLAs have already been negotiated with Doctors Council. So on the top, you can see we're adding $19 million there. And then what we have in the green areas, what we've labeled as underspending. What I think a key feature of what we're trying to do with this 2-year budget process is give the opportunity to the affiliate and the facility to realize savings within the contract. That could take the shape of less locums or maybe even less, sessionals. But we think by them working together, they will find savings, and up to 2% of that savings can be, kept and retained in the system and actually moved over to the next, contract year. Under the existing system, what would happen is if there's underspending, those dollars come back to central office. And we think that kind of defeats the purpose of what we're trying to do, which is devolve more control of the budget to the facility and making sure that they know they have those resources, not just for 1 year, but for 2 years, so they can plan accordingly. And then the next slide is the same basically for Sinai. You can see the numbers there. I think it's important to just mention here that when we get to the total values that were mentioned as part of the resolution, this is how we built the total value of the contract. We just multiplied these numbers over the 4.25 years, and there's growth in each year based on the COLA. For each of the 4 years of the contract. Next slide, is this Michelle?
Thanks, John. So the agreement terms which pertain to the clinical workforce focus on balancing the provider time for direct patient care with time for administrative, teaching, and research responsibilities, thus assuring that patient care is prioritized. With respect to research, which is an important part of what we do to promote our mission, we're currently negotiating a research agreement with NYU parallel to the affiliation agreement that we believe will facilitate even more research while ensuring that H&H administrative and other costs are in fact covered by the program. The clinical staff will be held accountable for complying with the professional code of conduct. In addition, these agreements will clarify the responsibilities for joint collaborative oversight of the clinical leadership with new commitments to ensuring meaningful performance evaluations based on both operational as well as clinical metrics. A consistently available clinical workforce which provides continuity of care to its patients requires that the affiliates prioritize full-time providers in their recruitment efforts, particularly in key specialties like primary care, pediatrics, OBGYN, general surgery, and key subspecialties. If we can go to the next slide, please. Of utmost importance to our patients is a provider workforce which reflects their own culture, race, and ethnicity. As quoted in the New England Journal over the weekend, lack of workforce diversity has detrimental effects on patient outcomes, access to care, and patient trust, as well as on employee retention. As you can see in the slide in front of you, currently anywhere between 34 to 40% of our providers are Caucasian at NYU and Mount Sinai, while only 8% of our patients are Caucasian. And while 8% of our providers are Latinx, 30% of our patients are Latinx. Both NYU and Mount Sinai have committed to developing a strategic plan for increasing the recruitment of underrepresented minority providers and service directors during fiscal year 22. Next slide.
And so now just to bring it home, so with that, we're seeking the board's authorization to enter into agreements with the NYU Grossman School of Medicine for services provided at Bellevue and Woodhull Hospitals and Gouverneur and Cumberland Diagnostic and Treatment Centers and Kohler Nursing Facility and Carter Specialty Hospital and Nursing Facility for a not to exceed amount of $2,008,589,842, which includes a 10% contingency, and for an agreement with the Icahn School of Medicine at Mount Sinai for services provided at Elmhurst and Queens hospitals and certain neighborhood and school-based health center Gotham sites for an amount not to exceed $1,416,148,570, which includes also a 10% contingency. And with that, we're happy to take your questions.
Great, thank you. I'll go through and poll the members for questions. Dr. Katz?
No questions.
Dr. Calamia?
No questions, just wanted to say this is just, as I'm watching this unveil, this is such an extraordinary job. I can't even begin to give the kind of congratulations that deserved. I mean, to have a multi-year budget, to have the kind of, responsiveness to local situations and changes as needed. I think any one of these 8 guiding principles would have an ambitious, goal. And you all have, it seems like, pretty much made some significant advances on every one of these. And I congratulate you for keeping these principles in mind and making some substantial improvements. So no questions, just vote.
Great. Thank you, Dr. Calamia. Dr. Harrison?
Yeah, I have no questions. I also would, since we're in the vein of giving congratulations, I think that the move toward racial equity amongst medical staff to match the community is critical at this point in time, and I'm glad to see it as part of these agreements. So just to say that, no further questions.
Thank you. Philip Waddle?
No questions.
Scott French?
No questions.
Barbara Lowe?
Yes, I'd like to comment, Dr. Calamia. You hit the keynotes. As a nurse and as an advocate in New York City, I would like to say this is a substantial improvement. Thank you.
Great, thank you. Robert Nolan?
I have no questions. I want to congratulate the entire team for all the work they put into this affiliation agreement. And I think that you did an outstanding job, and we appreciate what you were able to do in keeping us abreast along the way. So thank you so much, and I have no questions aside from my comment.
Thank you. Sally Hernandez-Pinheiro?
I just want to echo what's been said. No one would have blamed you all if you had sort of fine-tuned the agreements in the midst of all of that you've had to deal with over the last couple of years. And instead, you chose to create what John so artfully called the framework for the future. This is really a legacy piece, and it is taking the relationships and recrafting them and setting them in an entirely different future direction.
Great. Thank you, Sally. I think everyone has said everything that I would have wanted to say. I want to just commend you guys. I think I speak for the entire board, have learned a lot about the agreements, and they really aren't contracts. They're partnership agreements, as you guys have described, and it's been such a transformation. I think it's terrific, and really helps to align incentives and operate in a way that makes a lot of logical sense. So thank you. I do have one request. It's not so much a question, but it's obviously a very large contract. It's incredibly important to how we operate, but also financially a very large obligation. So, we do have a contingency value in there. And so if we could ask for sort of an annual reporting on how we're doing on the contract in terms of spending, would that be something, John?
Absolutely. Absolutely, Frida. Yes, we will keep you apprised.
Great. Terrific. So congratulations. Thank you. I think we can now take a vote. Propose a motion to accept the resolution. Dr. Katz?
Yes.
Dr. Calamia?
Yes.
Dr. Harrison?
Yes.
Philip Waddle?
Yes.
Scott French?
Yes.
Barbara Lowe?
Yes.
Robert Nolan?
Yes.
Sally Hernandez Pinheiro?
Yes.
And I vote yes as well, so the resolution is approved. Thank you.
Thank you. Are we doing that? Are we doing the Peggy one?
So,
Or did we do that already?
We did that.
Sorry.
Okay.
so he's
Jose
here.
is here.
Yeah, okay.
Yes, he's here.
Terrific.
Okay. See,
Committee and subsidiary reports.
I know. Okay, thank you, Frida. So committee and subsidiary reports to the virtual meeting setting. The committee and subsidiary reports were emailed to you for submission into the record. Are there any questions or comments about the reports? Okay, is there any old or new business to come before this board? If there's no further business, I declare the NYC Health and Hospitals Corporation Board meeting adjourned. Thank you so much.
Thank you.
Great job.
Thank you.
Thank you. Have a wonderful afternoon, everyone.
Bye.
Nice meeting you, Dr. Harris.
Have a good evening.
Take care. Penny, keep up the good work, Penny.
Bye.
He's gone already.
She's sitting in for Dave.
Mila?
Mila?
Or maybe
No.
for
Catch up
Hillary
later.
Clinton's.
About
Well,